New award-winning and internationally recognized research is being done at 2 Beacon trauma centers and revealing how a trauma patient's time spent in the hospital can be reduced. In this month's Eye on Health, WSBT 22's Aaron Leedy is looking into the findings that could have far-reaching implications for trauma patients. He's joining us now live in studio with more on how that process works. Aaron.
Juliana, it's a practice really derived from the military, and the studies into its effectiveness in the civilian world are pointing to the same results. Data collected from a year-and-a-half-long study in trauma centers at Elkhart General Hospital and Memorial Hospital in South Bend reveals promising news for trauma patients. If they're treated with whole blood, their length of stay in the hospital isn't as long.
When patients lose blood, they're not losing just one component of their blood, they are losing blood in general. And so by giving them back whole blood and all of the components at one time, we're allowing us, that's allowing us to start that process of resuscitation much faster.
The approach used to be, which component did a trauma patient receive first? For example, platelets, plasma, or red blood cells. Whole blood allows a patient to receive all of those back at the same time, a concept in which Beacon Health System is leading the way.
We were the first level 2 trauma center in the state to have whole blood. We were the first level 3 trauma center in the state to have whole blood.
From May of 2021 to November of last year, every trauma patient over the age of 18 presenting in shock was enrolled in a research study. Research assistant and South Bend St. Joseph High School senior Lee Erdman would compile patient data in a spreadsheet for review and analysis, a time-consuming process.
It was just very dependent on the week, but I'd find myself spending up to 4 hours a day, certain weeks.
The regular use of whole blood also comes with the challenge of collecting and storing it. 2 units are available at any given time for patients, but they're hoping for 4 in the future.
Anytime anyone in our community is donating blood, and I encourage our community members to participate in that, somebody's life is being saved each time you do that.
And the next step is to put whole blood onto medical helicopters and ambulances. In the studio, Aaron Leedy, WSBT 22 News.